Very, very good morning to everyone present here, to all our attendees, and a very warm welcome. I welcome all of you to the webinar we are having on Health for All Through Preventive Healthcare. And this is the second webinar series, which is brought to you by Star Health and Secura Health. And we're doing this in association with Kaveri. So I am Dr. Diana Henry Selvaraj, and I am the clinical lead at Secura Health. And I'm delighted to be your host for this event, which is being held in honor of the World Health Day 2023. This is the 75th World Health Day, for your information. And as we all know, the theme of this year's World Health Day is Health for All. And this is a goal that we all want to share. Our focus today is not just on preventive healthcare, which is an essential component of achieving the goal for health, right? And I also want to tell you how important preventive healthcare is. And we have two amazing panelists with us who can also, share their insights on why preventive healthcare is important to achieve health for all. So moving on. So what exactly is preventive healthcare? Preventive healthcare involves steps to avoid illness or injury before they occur, rather than actually waiting for treatment after they happen. It also includes measures such as vaccinations, regular checkups, and lifestyle changes like healthy eating and exercise. Remember that these actions not only promote individual health, but also benefit communities and societies as a whole. So chronic non-communicable diseases are the number one cause of death and disability in the world. Non-communicable diseases include heart disease, stroke, cancer, diabetes, and chronic lung disease, which are collectively responsible for 74% of all deaths worldwide. According to the World Health Organization, the total number of deaths from NCDs will increase to 55 million by 2030 if timely interventions are not done to prevent and control these. And in India, we have 5.8 million of NCDs that we see yearly. And what do we do to prevent this? Our panelists will be helping to answer some of these questions. And what exactly are NCDs? So as we all know, non-communicable diseases can include heart and lung diseases, stroke, cancer, and diabetes. And every year, 1 in 4 Indians have a risk of dying from NCDs when they reach the age of 70. These rates are alarming, but we can still turn things around if we take preventive healthcare seriously and look after ourselves and our loved ones. Many non-communicable diseases can be prevented by reducing common risk factors such as tobacco use, harmful alcohol use, physical inactivity, and eating unhealthy diets. So there is a little quiz for all of you. What is the theme of this year's World Health Day 2023? As you all know, I mentioned this in my introduction, so I just want to see how attentive all of you have been. If you have an answer, you can put it up in the chat. So the chat is open to everyone as of now. So, okay, so we already have answers. So I've already mentioned what the theme was. You all are right. It's health for all. I was just making sure you're all listening. So moving on, right? So we have our amazing panelists. The first one being Dr. Shirley Andrews from Kaveri Hospital. She is a family physician and she has multiple areas of expertise, which ranges from geriatric health, pediatric and adolescent health, antenatal and obstetric care, and also minor surgical procedures. And we also have another panelist with us, Dr. Dayanandan, who also has expertise in fields such as endocrine disorders, preventive medicine, metabolic and lifestyle disorders, and acute medical conditions. We will now start on with the panel discussion. Okay, so the first question for Dr. Shirley as well as Dr. Dayanandan, any of you can answer this question. So with the rise of chronic diseases such as diabetes, heart disease, and cancer, how crucial is the role of preventive healthcare to improve overall health outcomes globally?
So preventive healthcare, as you mentioned, involves three very important things. One is our lifestyle modifications, that is eating right and having healthy habits like exercises. Second one is regular health checkups, even if we don't have any diseases, that is to detect the diseases early. And the third one is adult vaccinations to prevent the diseases, to prevent infections majorly, and a few cancers also. Okay, so these are the three main things in preventive healthcare medicine. So diseases mentioned here are diabetes. I'll start with diabetes. India is now the diabetic capital of the world. The incidence and prevalence is increasing at an alarming rate, and it is estimated to increase at a much faster rate until 2030, unless some major drastic preventive action is being taken to stop the spread. Okay, so diabetes mainly has type 1 and type 2 diabetes. Type 1 diabetes is a genetic disease which occurs sporadically, and it forms only 5 to 10% of the total number of diabetics. So major population has type 2 diabetes, okay, which initially when we were in college were thought that it is a disease of older age. But nowadays, because of lifestyle changes and because of westernization, urbanization, we see it at a very younger age group also. The onset of type 2 diabetes, the age group is always in a decreasing trend, which is very alarming. And the second would be early detection is very difficult from the patient's perspective, because most of the people are asymptomatic. They are either detected when they get admitted with some other condition like fever or something which is not related to diabetes per se. Very few people themselves are aware of the symptoms of diabetes and get it checked. Most of them are not aware, or most of them don't have any symptoms. So picking them up or diagnosing them at correct stage or a very early stage is becoming very difficult from the patient's perspective and from the doctor's perspective as well. So this is where the role of preventive healthcare and regular health checkups come into play. When we do master health checkups, when we do health checkups and detect that we are diabetic, or even better if we are pre-diabetic, and we take appropriate steps to reverse the disease, then it plays a big role in the future morbidity, or it plays a big role in the quality of life of that particular person. Okay, and detecting diabetes early again is a very key thing to prevent complications of diabetes, like microvascular complications. The more earlier we detect and more earlier we start treating, or we reverse our lifestyle, the better outcomes are better for the patient. Major microvascular changes being kidney diseases, neuropathies, nerve diseases, and eye disorders. Okay. Second thing is heart diseases. Heart diseases, that is coronary artery disease, is the major disease that we are talking about here. Again, diabetes and insulin resistance is a major cause for, or a major risk factor for increasing heart diseases, increasing number of heart attacks in India and the world. So again, detecting diabetes early and reversing the lifestyle would have a major impact on reducing the number of heart diseases. For example, exercising every day or walking every day, healthy eating, all these will form a major step towards reversing insulin resistance, and also thereby preventing complications of diabetes like heart attacks and other complications, other microvascular complications as well. Third thing is for cancers. So cancers are again, the number of cancers are rising rapidly. One is because of increased medical technologies. We are detecting large number of cancer patients. More patients are also coming to us with symptoms, and we are detecting larger number of patients. So that is one reason for increasing rates of detection of cancers. As far as cancers are concerned, detecting cancers early makes a huge difference in the morbidity of the disease, morbidity of the patients, in financial state, as well as treatment benefits. The earlier we detect it, the better it is for the patient in respect to the quality of life, in respect to finances, and in respect to the benefit of treatment as well. So preventive healthcare or regular health checks plays a major role in detecting all these non-communicable diseases.
Thank you so much, Dr. Dayanandan. Just a leading question for the benefit of our attendees. You mentioned that a master health checkup is necessary to identify a lot of chronic diseases. So, according to you, doctor, what is the right age to get a master health checkup done, and how frequently should our attendees, or how frequently should people get it?
40 and above, we can get ourselves checked regularly, yearly once. And depending upon any issues we have, the timing would change and necessity would change. Okay. So basically 40 years and above. And most of us have people with diabetes in our family, our father, parents or grandparents. If we have any risk factor, particularly for diabetes or for heart disease or for any particular cancers, we can get ourselves checked earlier also.
Thank you so much, doctor. So I think this is a reminder for everyone who's in that age group to actually go and get ourselves checked to see if we have a risk of any of these chronic diseases. So moving on to our next question for the day. So most people know that prevention is key, but how can we make sure that they prioritize their health? And when there are so many other demands on their time and resources, how can they do this?
Okay. With regards to prioritizing our health, on a personal note, how I would prioritize is most of our work is starts from 8 o'clock or 9 o'clock in the days. So we could try to get up early and try to exercise early in the mornings. So that is one way to go about it. And second thing is we have to focus on our diet. Try to avoid processed foods and try to consume more fibers in our diet. Just have a normal Indian diet or something like that. So the first step in prioritizing our health is on diet and is on regular exercises.
Sure. So again, that is a reminder call for everyone who is here. If Dr. Dayanandan, being such a busy doctor, can prioritize his health and make time in his busy schedule, I think all of us can do it. So this is a wake-up call for many of us as well. So thank you, Dr. Dayanandan. We'll move on to the next question that we have. So how can we leverage the power of social media and other digital platforms to raise awareness about the benefits of preventive healthcare?
Okay, so hi.
Dr. Shirley. Hello.
I think I'll take this question.
Sure.
Thank you for having us here. It's very, it's a pleasure. Dr. Dayanandan and I, we are very happy to be representing Kaveri Hospital. So let's talk about social media. I think this is very important and in thing, for our times when everyone is basically on their gadgets. The idea is social media and other digital platforms can play a role, but it can have both negative and positive aspects. It's a double-edged sword. So just as much as there is so much information available, it's a world of information, we need to be very careful what we take and what we discard. Because this is a very good platform to get information, awareness, and stay up to date in a lot of health-related things, just like it is useful for every other aspect of life. But at the same time, it should not be misused because there is so much of information available. People can get carried away. They can get misled. They can overthink or underthink related. So for example, just to say, if somebody had a headache and they were to Google search what causes a headache, they could get anything from migraine to, a space occupying lesion or something like a brain tumor, so it puts in a lot of unwanted panic. But at the same time, if we are able to filter out and use it in the right way, we can make use it. There are a lot of advantages from social media. So my general rule to everyone is use things that are helpful. For example, health talks, like what we are doing now. Go to reliable sources, go to reliable websites where the information is correct, precise, and at the same time relevant. So for example, during the COVID pandemic, there was so much information, but it had a lot of benefit because every time you clicked on COVID, you would learn about hand wash, you would learn about social distancing. So those things which are very apt and important for you, make use of it. The things which are more in detail, please talk to your doctors. There's nothing like talking directly to your doctors and getting the information from their mouth. We are more than happy to share the information which is important for you. So avoid diagnosing and treating yourselves from online platforms, but do use the awareness. So if you are worried about lifestyle, okay, someone has told you that your lifestyle is not good, you need to change it, go online and check what are the types of exercises you can do, what are the types of diets you can follow. Keep things that are minimal. Anything that goes more than that, medical or involving treatments and diagnosis, talk to your specialists. I think I give a very general answer, but of course, if you have any queries, we can take it up further.
That was very well put, Dr. Shirley. Like you said, if I have to reiterate for all the attendees that we have. So, Doctor, you very, very clearly said that we can use social media for awareness and education, but not for diagnosis and treatment. That was very well said. And I think Dr. Google has been the #1 most teleconsulted doctor on the internet today. But yes, I think we should all be moving to our actual doctors or our actual physicians to ask what our problems are rather than asking Google for it. So thank you, doctor, for that. We'll move on to our next question. Yeah. So what are the vaccinations that you recommend for an adult? So let's say one of us walk in. So what are the vaccinations that you would suggest?
Okay, again, this is a very important question because of late, whatever the COVID pandemic has taught us is that we have something like I wouldn't say a magic bullet, but something that's really, really advantageous are the vaccines. So without having to deal with the illness on the whole, we are able to get this 1 or 2 injections that makes us ready to fight the infection. So it's a really great science that has brought out multiple vaccines, and we are all having the misconception that vaccines are just for babies. Only when they are in the pediatric age group, they have to go through all their set of vaccines and then they're done for. In adult life, there is no vaccines. But it is, of course, more important in the childhood because the immunity is not fully developed. So it has a lot of benefit, but there are some particular specific guidelines we have to follow for adult vaccinations also. So as a family physician, as a part of preventive healthcare, we do advise here at Kaveri, we do have an adult vaccination clinic as part of our preventive health. So what we deal with here is we put the patients into 3 categories. The first category is the absolutely normal, no comorbidities, non-pregnant. The second category is the ones who have some comorbidities, as in they may have a diabetes or a cancer or certain health condition. For them, the vaccine list is different. The third category is the pregnant, because pregnancy is a different ball game altogether. So there are some vaccines we would give, some vaccines which are completely contraindicated. So this kind of putting them into categories makes it a lot easier. So when we come to adults who have no health problems and are non-pregnant, it again comes down to the age. So the 20 to 40 age group is the age group which is going to be on the go. They are working, they are studying, they are exposed to a lot of things. But again, they are quite healthy. So a few things we can avoid. But we do advise the regular flu vaccine for all age groups above in adult age groups. The seasonal influenza vaccine is ideally given in the months of September, before the month of September, so that they have enough immunity to deal with the seasonal flu. And this changes from year on year. There are some changes that occur in the virus itself, due to which the vaccine you got last year may not help you for this year. So it's a yearly, annual vaccine. So if at all you are worried about what vaccine I need to give, your first and most important adult vaccine would be the flu vaccine, the influenza seasonal flu vaccine, which is ideally taken before the month of September. And it's a single dose. Coming to the other vaccines in the more aged population or the populations having other health conditions like asthma, chronic pulmonary diseases, etc., we have something called the pneumococcal vaccine. And the pneumococcal vaccine also has a lot of benefit. And the dosing, you can give it as a single dose or double dose depending on their age. So all these things we are discussing in detail when they walk into our clinic. And the other things like hepatitis A, hepatitis B, these are also counseled on depending on the risk factors, especially those who are traveling. So when you're traveling, certain vaccines are important, like hepatitis A and typhoid, which you can get through food and water. So if you're traveling and you feel that you have not been vaccinated in the past, you can always take this vaccine as well. Coming to hepatitis B, it's specifically important in diabetic population because they are constantly undergoing blood tests. They are constantly pricking themselves to get their sugar tested. They may be on insulin. For this reason, coming in contact with blood and needles, they need to be sure that they are protected from hepatitis B. So for this, we have some tests which we can see antibody levels, we can screen. So this is all going much into depth, which we probably need not discuss right now. Knowing that these vaccines are available, particular age groups, particular health conditions, certain vaccines are more important than for others. All you need to do is walk in and come and see us. So we will tell you what suits you, what you definitely require, what you can avoid. And if you are at a higher risk, we will be advising you for specific vaccines. Just a small note on HPV or human papilloma virus. Again, this kind of awareness is very, very important because it should be given as early as 9 years of age in boys and girls. Okay, it's not only for females, it's given for males also. And as early as 9 years, you can start protecting our kids. So, once they're done with the pediatric vaccines and they're moving on to the pre-adult or adolescent age group, then and there itself, we can start protecting them from these infections. So, in a nutshell, this is just about the overlook of things. But of course, it more in depth when you come and visit us in our clinics. We can tell you what is required for you.
Thank you so much, Doctor. That was very informative as well. Just a leading question again for the benefit of all our attendees. So a lot of us, right, have certain inhibitions about the after effects of vaccines, especially after COVID vaccine came. There was all this, there was just this rumor that it's causing a lot of heart attacks in young adults. So what would you do to alleviate some of these inhibitions, and what is your comments on that?
This is a common question we come across. A lot of the patients do ask us, doctor, you are telling us to take this vaccine. What if it turns out to be a problem for us? So here the thing is, when it comes to COVID vaccine, it's a relatively newer vaccine. Okay, it was prepared very urgently because the pandemic was going out of hand. So we didn't have as much data as we have with the other vaccines, which are routinely given, like influenza vaccine, hepatitis vaccine. These are all given over many years together. We have been giving these vaccines, and we have definitely come out with conclusions that the benefit is more than the risk. If at all there have been some reported cases, the numbers are very less, very rare, and sometimes it is associated with other issues also triggering these reactions. But we take all the general precautions before administering the vaccine. We do talk to them. We ask them about their any allergic tendencies, if they've had any allergies to, for example, egg allergies or any specific problems they have. And we observe them for 10 to 15 minutes after the vaccine is given. And we give them advice on when to report if they are having any issues. And I can tell you that the incidence is very less. With COVID, we are still trying to get more information on what are the real reasons why there were certain reactions, whether it is really vaccine related or some other complication that led to it. So we are trying to get hold of information on that. But these vaccines like MMR, typhoid vaccine, all of these have been over many years, and the outcomes or the studies do not show that higher risk with these vaccines.
Thank you again, Doctor. I think the bottom line here is that the benefits of these vaccines far outweigh the risks. So yes, we all should actually look at getting these vaccinations done to prevent ourselves from getting a lot of diseases out there. So moving on to our next question. So the question for... So can you share any personal anecdotes about how preventive healthcare made a positive impact or saved the life of any of your patients? So from Dr. Dayanandan and Dr. Shirley, any one of you.
Yeah. There has been many instances, instead of telling one, especially in people who are detected at a pre-diabetic level, in people who have dyslipidemia with no other, or cholesterol abnormalities with no other complications or no other symptoms, in persons who are hypertensives, definitely the lifestyle changes have reversed their diabetic status, the pre-diabetic status, their insulin resistance. Insulin resistance is something that is majorly a cause for diabetes, that is a cause for hypertension, that is a cause for dyslipidemia, and so on. So when insulin resistance is addressed at a very early stage, that is if they are pre-diabetic and we detect them, or they are pre-hypertensive and we detect them at an early stage when they come for a routine health check, and they reverse their lifestyle and dietary habits, definitely they wouldn't have, they wouldn't need any medications to, medications for their diabetes or their hypertension. They can just reverse it with their diet itself.
Thank you, Doctor. So I think from a very, very really extreme example of how preventive healthcare actually impacted one of the celebrities, from the top of my head, right? I think Angelina Jolie had a BRCA gene for breast cancer, and she decided to get a double mastectomy done so that she never gets breast cancer in her life. And I think that was a very nice example, which actually impacted a lot of people, because she being such a huge celebrity, I think when she did such a drastic step to prevent breast cancer, I think it reached a lot of people as well. So that was a very good example. So thank you, Dr. Dayanandan. We'll move on to our next question. Before we move on, I think some of our audience, our attendees, have been asking questions. We'll take the audience questions in the end. So if anyone has any questions in the middle, please type out your answers or your questions in the question box. So we will address them at the end of this conversation. Okay, moving on to our next question for the day. Can you elaborate the correlation between an individual's dietary habits and the development of chronic health conditions?
Yeah, this is a very important disease. As I mentioned previously, insulin resistance is the major cause, a major factor for development of diabetes, development of hypertension, development of cholesterol abnormalities, and so on. Okay, so once the patient develops diabetes, or once the patient develops insulin resistance, he is prone for having, or he is at a higher risk for having heart diseases, he is at a higher risk for stroke, for certain cancers, etc. So, major cause of insulin resistance is two things. One is sedentary lifestyle, and second thing is diet. So diet is a cornerstone, or is a very important factor for development of insulin resistance and development of diabetes, etc. So correcting our diet, or having a proper diet, eliminating certain foods, adding certain foods will go a long way in reversing insulin resistance. If we develop insulin resistance, making certain changes to our diet that we're having now, and certain changes to our lifestyle will go a long way in reversing the insulin resistance, thereby preventing all these complications.
Thank you, Dr. Dayanandan. Just a leading question again for the benefit of our audience, right? So you mentioned about how our meal should look like. So what would be your ideal definition of a nutritious diet? You cannot generalize it, but if you have to tell probably a good example of what a lunch should look like, maybe. So a South Indian person's lunch, what do you think should it consist of?
We are majorly rice eaters in India. The problem is not rice, the problem is the quantity that we take, okay, and the surrounding stuff, okay. So what I would do is I would just strictly have 1 cup of rice, and I'd have more amount of vegetables. I would have more amount of fibers, okay, vegetables which contain a lot of fibers and contain a lot of water in the diet predominantly. So I would use more vegetables, and we can also increase the amount of protein in our diet.
Yeah, I think Doctor rightly said the rice is not the problem, the quantity of rice is the problem. So we should all stick to 1 cup of rice. That's what Doctor says. But for further, breakdown of what you can eat and what you shouldn't eat, I think it's best to actually consult a doctor and, probably go to a nutritionist based on their advice so they can tell you exactly what to eat. And like Doctor said, diet plays a major role in our health. So we should all be mindful of what we're eating. Moving on to our next question for the day. What exactly are lifestyle diseases? This is a very basic rudimentary question, but I think we've been talking about lifestyle diseases, and there's a lot of information about lifestyle diseases, doing the rounds and on social media. But what exactly are these? Can one of you just let us know?
Yes. So I think our whole talk is revolving around this particular aspect, which is lifestyle diseases, and it is, very specific for this day and age where the lifestyle is very, very erratic. It's very erratic in the sense we have seen people walking into our clinic just saying that they are not getting even an hour's time to spend with family, but for their own health or for their own benefit, they are not getting, because they go early in the morning, they travel many kilometers, then they go and sit in the office for again many hours at a stretch, and then come back home, and then the dinner is delayed. So the thing is, all in all, it is a purely external induced disease. There is, of course, there may be many underlying things like genetics and something that is there from hereditary and other things which can add on. Like, for example, they may already have diabetes in the family and other things. But purely from an environmental reason, due to environmental causes, they have developed this disease, is what is lifestyle diseases, which is very, very sad in one sense that people at as early as 20 are having type 2 diabetes. Because previously we would say, as Dr. Dayanandan was saying, there are two types, type 1 and type 2. But previously we would say that someone as young as 20, if they are having a diabetes, probably it was a type 1, which is the genetic form which they are having from childhood. But we are seeing cases at as early as 20 with type 2, which is like a purely lifestyle related disease, which indicates that it probably started very, very early, starting from childhood obesity, which later led on to this kind of. So lifestyle diseases, of course, in the working age group, it's related to their food and their lifestyle and their lack of exercise, sedentary work and other things. But even the childhood, we are not taking enough attention, because we are seeing that kids these days prefer to sit at home and play video games than go and play out in the sun. So these kind of changes, a complete shift of everyone sitting at their desk or sitting in front of the TV or basically sitting. So we are saying that sitting is equivalent to the new smoking, so even if you get up and go and smoke a cigarette, it is better than sitting for so many hours in front of whatever screen you are. But the thing is, this is not to say that smoking is right. Please don't take me wrong. Smoking is also equally bad. But the fact that we are thinking that so many hours of inactivity, it's very, very dangerous, and it is causing a pandemic of diseases. And it's coming as a combination of diseases, not just diabetes. It is diabetes with high blood pressure, with high cholesterol, with high uric acid, and heart diseases. So it's called a metabolic syndrome. And in addition to this, a lot of orthopedic problems also, neck problems, back problems, joint problems, all this because our posture is not good, or so many hours of sitting in one position. We are having all kinds of vascular problems. The blood flow is not going well, and so there are clots getting formed. And so many hours of sitting in one position is not good. So I think companies and workplaces as well as homes, we all have to make a lot of changes in our lifestyle, because in the long run, this is going to be more dangerous than smoking or alcohol and things that we know are not good for health. This needs a lot more awareness. So essentially, lifestyle diseases is your 8 o'clock in the morning to 8 o'clock in the night, whatever you do. And even after that, that is, if you're not sleeping on time, you're delaying your bedtime, as well as eating your late dinners, as well as spending more screen time, all these things, what it leads to in our life, in our health, is what is the lifestyle diseases. And this is basically common knowledge that it is not good, but at some point we need to take the changes to be made. And based on each and every condition, it is being managed accordingly. But the first step is that we are going to tell them is change your lifestyle.
Thank you, Dr. Shirley. I think you very nicely, summed that up. Like you said, sitting is the new smoking. So I think that's something that we should all keep in mind. And you mentioned how we have to include these changes even in our children, right? In our children's daily routine. So how do you encourage children to actually do what you want them to do? It's very difficult, but what can you do to tell them or make them understand that it's important?
I think one thing that really helps with the children is, rather than being negative and telling them that, see, if you don't do this, we will remove your screen time, or do that, make it positive. Like, give them something to look forward to, some encouragement. Like, so if you spend so many hours playing or swimming or doing this, then you can watch, a half an hour of this cartoon or whatever you want. So make it more positive than negative. I think children are very smart in that sense that, they know that if something is not working their way, they can use other techniques and all that. But we need to be very strict, because, we have seen how this impacts people as they grow into young adults and again as adults. So it also takes a toll on their, mental health when they are obese or they are overweight, and kids make fun of them. So we need to be very supportive of them mentally and emotionally, but also be strict to them in these aspects, because just to give an example, my daughter is very afraid of pain. So if I tell her that, I'm going to have to give you an injection, then she gets scared. But I don't think that's the best way to develop the mentality in the kids. It should be more of positive. So if you are going to go and play outside for so much time, then I'll give you half an hour of TV. So something like that. So half an hour of TV is better than no TV. So for them, that will be something positive. It's a very difficult thing. But again, we have to make a balance of it.
And I think, unsurprisingly, today's children are really aware of a lot of things. I have a 8-year-old cousin of mine who's already on a diet. I'm not sure for what exactly, but okay. So I think that's the impact of social media maybe, and awareness in general. So I think our next generation is actually very receptive of feedback, or very receptive of what we have to tell them. So moving on to our next question for the day. I think we have just a couple of more questions. So what are some of the most important nutrients that people should, overlook in their diets? Or what do they usually overlook, and what should they include in their diets?
Okay. So I'll emphasize on two things here. One is the timing of the meals also. As Shirley ma'am told, earlier dinner is a very important thing to do. The earlier we have dinner, better it is for our insulin resistance and so on. Okay, the quantity of diet is very important. So small, frequent feeds is always better than larger meals at a bigger interval. So small, frequent meals is better, and earlier dinner is better. These are the two things. And regards to some nutrients that we overlook on our diet, definitely our diet is deficient in proteins. The macronutrient that is most efficient in our diet is the protein, the quantity of protein. So what WHO recommends is 1 gram per kg body weight of protein in our diet. And if we look at our diet, we don't even satisfy around 20% or 30% of the daily requirement. So proteins, lentils is something that is very important in our diet, the protein intake. If we are vegetarians, we can make use of milk proteins. We can take more of paneer, more cheese, and so on. And if we are non-vegetarians, we can stick to lean meats most of the weeks, like chicken and fish. And once in a month or twice in a month, we can maybe have mutton or things like that. So protein is one of the macronutrients that is very less in our diet generally. Coming to micronutrients, our diet is deficient in many vitamins and minerals and fibers as a whole. So specifically, vitamin D, which is not mainly from the dietary sources, are deficient in most of us because of our decreased exposure to sun. So we can improve our vitamin D with certain specific diets like mushroom, eggs, milk, and also exposure to sun. Doing more exercises in the outside also improves our vitamin D naturally. And vitamin B12, the only thing is animal sources have more vitamin B12. Plant sources do not have vitamin B12. But then milk and other milk products do have some vitamin B12 in them. So only pure vegans will be deficient of vitamin B12. If they are vegetarians, they will still get their B12 in their diet, provided they have enough milk and milk products in them. So, and the third thing is fiber. Again, decreased fiber diet has been associated with a lot of problems, starting from constipation, hemorrhoids to GI cancers. So increasing fibers, that is having appropriate amount of nuts, having appropriate amount of fruits in our diet and vegetables will increase the fibers in our diet. And they also keep us satiated so that we don't have to eat very frequently and we don't have to go in for high carb foods.
So thank you, Doctor. I think you've covered most of the points that probably people would want to know about. Just one thing from my side, right? You mentioned that vegans might have a lot of deficiency in not just proteins, but also B12. So in that case, are there any food options for them to choose, or do they have to go for any additional supplements, or should they just consult the doctor? So what is your
definitely they can they have to take if they want to follow veganism, they have to take some supplements to address their vitamin deficiencies. So that is the way to go about it.
Sure. That's a good information for all the vegans in our attendees today. So moving on to our next question. So what are the simple tips to prevent developing chronic diseases? I think we've spoken about a lot of tips in all our answers, but if you have to just sum it up, in one shot, right? What would be the topmost tips that you would suggest?
So, as you said rightly, we are going to just sum up whatever we discussed till now. As I would tell any of my patients who walk into the clinic, my first step to do would be eat when you are active. So the daytime, when you are running around, when you are active, when you are doing your work, catching a bus, doing all that, make sure you are not running on zero fuel. Make sure you are having sufficient fuel to get you through these activities. So a morning breakfast is extremely important. Having your lunch on time is extremely important. Don't skip these two very, very important meals of the day. The reason being, if you are not having any fuel to do that work for you, your body thinks you are in a starvation mode, and it starts using anything and everything to produce, make you get through the day, which causes a lot of imbalances. And you are basically going to be running on steroids. Okay, so you have to do the work, but you don't have the fuel. So the idea is, make sure you are giving the sufficient amount of fuel to get you through the day when you are active, when your brain is functioning, when you are going and doing your activities. Don't be on empty or zero fuel during that time. And night times, when your body is going to have literally no activity whatsoever for 8 hours of sleep, there is going to be no utilization or minimal utilization of fuel. During that time, keep it light. So the ideal thing is sunset to sunrise, better not to have anything, because during that period of time, it is a good time for the body to start using whatever excess fat we are having. So you must have heard of the concept of intermittent fasting, wherein from a particular time of the evening, probably like around 6 or 7, to the next day morning 8 till you have your breakfast, you are in complete fasting. That is not going to affect your body in any way. Okay, and at the same time, it's a good time for the body to replenish all the aspects that were done throughout the day. So I do suggest not skipping breakfast, not skipping lunch, and having earlier dinner. but at the same time doesn't mean you eat like a 4-course meal or something like that. Have the balanced diet as we had discussed from the dietary part of it. Have good amount of proteins, good amount of vegetables, nutrients, minerals, all these things. Minimize the carbohydrate. Carbohydrate is also important, but at the same time minimize it and don't overdo on that. So that is about the diet part of it. Be active. We've seen that lack of activity has its own set of problems related to that. So be active during the day as and how you can. So take the stairs if possible. Try to avoid junking during the day. Maximum try to cut down oily and fried food. Till once in a while, we are all human, we do feel like having a cheat day. Of course, keep it as minimal as possible, processed foods and these things. So if your routine, that is your weekly routine is set, this once in a while having fried food or something is okay, it's acceptable. But if that becomes the routine, so every day you are having fried food and every day, then it's impossible to come out of that cycle. So what you eat, be mindful of what you eat. Make sure you are not starving during the day, and as and where you can, include a lot of fiber and greens, because that is going to make you full and at the same time increase your fiber, your digestive health, and a lot of water. I think that is one thing we all overlook. We are not consciously drinking water. Make sure you note how many bottles of water you're drinking during the day, because most of my patients, I ask them, do you drink enough water? Then they say yes. Then I ask them how many bottles, they'll say 1 bottle, which is like 750 ml, which is not enough for the entire day. Make sure you are consciously taking at least 4 or 5 bottles during the day, more during summer, to avoid stones and other kidney related problems. So food, water and exercise, I think these 3 are the most important things. These are basically general tips to avoid things from happening in the long term.
Thank you, Doctor, for that summary. I think one very nice, concept that I read somewhere was, in terms of breakfast, lunch, and dinner, right? So it was very interesting because it said, eat breakfast like a king, eat lunch like a salaried person, and eat dinner like a beggar. So that is... so that was something that stayed with me for a long time. And we will be moving on to the last question of the day. Before that, if any of you have any questions, please feel free to type out your questions either in the chat box or in the question and answer box. And we will be taking up your questions shortly once we finish our session. That is probably in the next 5 minutes or so. So if you can ask your questions, we'll move to the question and answer very shortly. So the last question for the day, as we look to the future, how can we continue to innovate and push the boundaries of preventive healthcare to ensure that everyone has access to the care they need?
So I think the most important is something like the talk we had just now, which is awareness. Once people are aware, they take the interest to do it. I think also companies should have that, they should push the employees to get regular checkups and things like that. And maximum we can do from our side, we will do. We will be in touch with the people, and we will continue to give talks like this and keep everyone aware. Preventive health, I think everyone must be having an idea. Basically, it's a very structured thing. So if you are in a particular age group, you know that you are at a risk of a couple of things. Then and there, get it looked into. And once we detect something abnormal, we will be following it up frequently, or accordingly, we will be giving the advice. Staying in touch with the physicians, at least yearly once. Locate some particular physician or somebody who is very comfortable for you from all aspects, So, and once you located them, get their advice and follow it strictly. That way you can avoid a lot of other healthcare expenditures. This once a year walking into the clinic and getting a health checkup avoids a lot of unwanted expenses in the form of hospitalizations, admissions, surgeries, etc. by doing this timely thing. So I think if we think of it from overall, not just health related, but it's also going to impact your life and your finances in a long way. If we think of it in that sense, I think we will be motivated. and also know that we are there to help at every step. I think that is probably the one motivation and one assurance we can give from our side.
Sure. And this is for both the doctors, right? There are a lot of, healthcare applications and, new devices such as watches, fitness trackers, things that are coming up. Every day that we find a new device or we find a new application that promotes health and wellness. So is there something specific that you would advise or, advise against, and why? For preventive healthcare in particular, is there any application or any device or any innovation as such that you would suggest for your patients or you think would help for preventive healthcare?
Yeah, I think it should be taken with a pinch of salt, because what we have seen, these Fitbits and things like that are very helpful to a large extent. It tells you how many steps you have taken, how your heart rate is fluctuating, all these things. But I've also seen another extreme where people get over conscious. They may just be sitting and they may be anxious about something. Suddenly the heart rate goes up and they get even more anxious looking at the reading. So they shouldn't be obsessed with these gadgets. Use the gadgets as a indicator for specific things. Like, for example, you're worried about whether you're for certain reasons, whether you're not getting enough exercise in a day or something like that. Use your gadgets, but don't over look into it. If you have such queries and things, definitely it makes better sense to talk to the doctors or visit a hospital and get it cleared out. Use this as a support. It should not become a problem for you. It should be a support to you in your day-to-day.
Sure, doctor. And I think Secura Health is also, in that space of digital healthcare, and we are, constantly promoting, innovative ways to, promote healthcare. So digital ways to promote healthcare as well. So we will move on to our final session of the day, which is the question and answer session of addressing the questions from the audience. So before we close, do we have any questions? I think some of you have already typed out questions, so I think we'll take one by one. I think the first question, Dr. Dayanandan and Dr. Shirley, there's no name here, but someone's asked, what are all the preventive health checkup tests that we need to take in a year? What tests are included in the preventive health checkup?
Generally, we do basic blood tests, which includes counts, a complete blood count, renal and liver function tests, blood tests for sugars, cholesterol levels, and ECG and chest X-rays. We do a screening echo. It depends on, there are so many packages, which varies for each person. So what applies to them, they can choose. Okay, so basically, these includes chest X-rays, ECGs, and basic blood tests like sugars, cholesterols, and also blood counts, renal and liver function tests. For people with strong family history of, say, any gastrointestinal cancers or anything like that, they can opt for 3-yearly endoscopy or colonoscopy. So we can also do some specific tests based upon their risk factors.
And doctor, for cardiac issues, what do you think is the number one test or the top tests that we have to take to prevent cardiac issues?
To prevent. So right now we're doing ECG, resting ECG. We're doing a treadmill test, which comes in most of the packages, and we are doing a screening echo. But if any patients have particular symptoms like chest pain or anything like that, and they also have other risk factors like diabetes, I think it is better to go for a coronary angiogram. So that would give us a clear view on whether there is any heart block in the arteries or not. But for other people, treadmill test, ECG and echo would do.
Okay, thank you so much, doctor. So we have another question from Bindu. She's asked, there's a question regarding cervical cancer vaccine. So among my friends group, there are always doubts about what age it can be given. Is it before puberty or after puberty? So can some advice be given on this?
Yeah, so as we were discussing this cervical cancer vaccine, HPV vaccine, It can be given as early as 9 years. So the recommended age group is adolescent from 9 years of age. 9 to 11 is actually the age indicator. The reason being it provides lifelong immunity. That is the idea. So the earlier, the better. It's not really related to puberty as such. But the problem happens when they have not received it in that age group. Then it doesn't mean that we should not give it. We can give it all the way till 26 years of age. Okay, again, it is bound to have some amount of efficacy, but it's not as efficacious as when given early. Now, after 26 years of age, it seems to not have much benefit, but those who are at a high risk. So if they have family history or certain high risk category people, we do advise them to take it after 26 years. So it's not like you shouldn't give it. It can be given at any age. The earlier you give it, that is at 9 to 11 years of age, it is more efficacious. And as they age, the effectiveness is not that much. That is the only thing. But that doesn't mean you cannot take it. It's not contraindicated. It can be given at any age.
Thank you, Doctor. I think a lot of women today have that same question. So I think you've answered it for all of us. So the next question from Bindu is there any vaccine available for breast cancer?
Yeah, so for breast cancer as such, because it's not in any way related to any infection. So vaccines are generally given for any infection related cancers like cervical cancer. We have seen the cases are more when they have the HPV infection. So to prevent that infection, we are giving the vaccine. In breast cancer, there is no such infection that is causing it, but there are some genetic reasons why a person may be at a higher risk. So we do genetic testing, again, not for all people. We do it for those who are at a higher risk, like their mother or sister. That is the first degree relative, right? So if mother or sister or maternal aunt is having a breast cancer, they are at a higher risk. So we can do a genetic screening. But though we talk a lot about genetic screening, the commonest cause of breast cancer is sporadic. That is for no reason. It's not only genetic. The next cause is only genetic. So there is actually no test. But of course, we have our screenings done in the health checkups where we advise them for self-breast examination. We also do the ultrasounds. After 40 years, we do the mammogram. And higher risk, we can do further screening tests. So that is also included in the health checkups.
Thank you, Doctor, for that answer. So we have another question from Indu. So she asked, from what age should we be doing annual health checkups? I think Dr. Dayanandan had already answered this question, but I think there's a doubt again. There's a question again.
Yeah, there is no specific age group where health checkups should start. Generally, we recommend yearly after 40 years of age. With people with family history of diabetes or family history of heart diseases, they could get themselves checked much earlier also, but then the frequency might not be yearly. They can have themselves checked every 3 years or something like that.
Sure.
But recommended after 40 years, a yearly checkup is recommended.
Sure. We're moving on to the final few questions. If anyone has any other questions, please feel free to type out your questions and we'll answer them shortly. So going on to the next question, are there any environmental or occupational factors that can impact preventive health, and how can individuals protect themselves from these risks?
So, Dr. Dayanandan, do you want to answer?
Yeah. I think he's mentioning about specific work environments. Generally, if you see because of urbanization, the pollution level is very high in Chennai and most of the cities. So if we want to go out and work out, early hours in the morning would be the best time to work out to reduce the impact of pollution to our lungs. Okay, and wearing a mask is almost mandatory, just not to prevent COVID or any other respiratory diseases, but also to prevent all the diseases caused by toxic fumes and other automobile fumes. And as far as work environment is concerned, certain factories have high. They have issues regarding high decibel sounds or high fumes, toxic fumes as well. So we just have to take the specific protective equipments. We can use like ear clips, or we can use masks to prevent them all.
Thank you, doctor, for that informative answer. So we have another question on whether Star Health insurance covers preventive preventive checkups. So I think we have Ashini who can take up that question and answer. Ashini, do you want to take up that question or? Okay, so I'll just give you an answer. I think we had a representative from Star Health, but probably she's having some issues with the audio maybe. And the simple answer to this is yes, you will have preventive checkups covered with your policy. And we also, in association with Star Health, we also have a lot of wellness programs that's running for all policy holders, which are free of cost. So if you are a policy holder with Star Health, you will have access to most of these wellness programs. So moving on to our next question, I think this is probably the final question that we have. What are the strategies to maintain a healthy weight and to prevent obesity, which is a risk factor for chronic diseases?
I think we have been discussing this from the beginning of the talk, right? So about food, lifestyle, exercises, and strategies for maintaining healthy weight. Start early. I think that's very important. From the childhood aspects, from preventing childhood obesity, maintain healthy weight and preventing obesity, and risk for many chronic. So weight is a very important risk factor. So we have environmental and non-environmental. So hereditary and other risk factors also play a role. But in addition to that, your environmental factors like your food and your lifestyle and your exposures, smoking, alcohol, all your additional aspects can add on. So I think leading a very healthy lifestyle is important, and keeping everything in a balance, making things bare minimum. So junk food, oily food, fried items, and a well-balanced diet. Essentially, these are the things. Get a good dietary advice and follow it strictly. Once in a while is okay, but then on a routine basis, we have to be very careful with what we eat and how we do our day-to-day activities.
Sure. Thank you for those answers. I think we've come to the end of today's webinar. So a very, very, large thank you to both our panelists, Dr. Shirley and Dr. Dayanandan, who answered patiently and, took up all the questions of our attendees as well. And to sign off as a public health professional at heart, prevention is something that is very close to my heart. And if we can prevent diseases and move from illness to wellness as a community, we would be in a much healthier space. And by making some lifestyle changes in relation to nutrition, in relation to sleep, stress levels or mindfulness and physical activity, I think we can all make a huge difference. If not for anyone, we should do this for ourselves and reap the benefits of having a healthy and happy life. So thank you again to all our attendees, and thank you to our panelists who joined us, and we will meet in the next webinar. Thank you.